The latest word from the White House is that the website healthcare.gov will be working for most users by the end of November. That's 5 weeks from now, and that is not good enough for lawmakers who continue to call for a delay in the application deadline. Visiting a call center in Austin Friday, Health and Human Services Secretary Kathleen Sebelius says there's no need for a delay. She also said she would have liked to have more test time on healthcare.gov.
Well, actually, I didn't realize it wouldn't be operating optimally before the launch. I think we knew that if we had had another 6 months, we would probably test further. But I don't think anyone fully realized that both volume caused some problems, but volume also exposed some problems.
When asked about calls for her to resign, Sebelius said the people she works for do not want her to quit. Secretary Sebelius will appear before a congressional committee on Wednesday. 2 contractors who worked on the website say last-minute changes by the government and not enough time to test the system is what led to problems with healthcare.gov. So should the March 30th application deadline be extended, and who should be held responsible? That's what we're talking about this half hour, and we want to know what you think. So join the conversation with us on Facebook and Twitter. In our newsroom again, Chris Tritico, Jackie Bally, and Mustafa Tamiz. Good morning, you guys.
Good morning.
Hello. All right, so how about it?
You know, this is huge. This law passed a little over 4 years ago. The administration has had 4 years to build this web page. Now, I understand they thought all the states would join in, but they didn't. And so they've had a very, very long time to build this web page. And this is the president's signature accomplishment during his time in office. And the fact that this thing doesn't work after 4 years is unconscionable to me, that they couldn't get this thing working in a timely fashion. And for Kathleen Sebelius to say we needed 6 more months, you know, they've known for a very long time that they had to have this done, Mustafa Tamiz. And this really plays right into the hands of the Republicans, doesn't it? They've been saying this law is not ready to go. And here we are with the signature thing, and now it's going to be November the 1st or the end of November before they can get it working.
Jackie's giddy. I'm having a hard time.
That's right.
Look, there are 55 contractors that are involved in putting this site together. It's multiple systems that have to talk to. It's one of the most complicated systems in order to be able to provide healthcare. It's a very giant apparatus to do. And I agree with you that they had time, but they also, you know, in the era of sequesters where funding was being cut, in the era of the kind of like the Benghazi gate where, you know, all government agencies are worried about what Congress is doing. You know, I like to also know like who's responsible for causing the damage when the country was shut down. But in the end, I think President Obama is making a huge mistake. I think rather than bringing in someone from the outside to look at the system, I think he should reach it internally. I think he should go to the NSA. And he should find the guy and the programmers that were able to tap into Angela Merkel's, phone systems and the phone system for all of us, and put them in charge of this because they need something else to do other than to tap Americans.
Does Kathleen Sebelius need to go?
Yes.
Well, look,
I haven't come to you yet.
She's giddy. I feel like I should just keep talking and talking and talking. I should do the Ted Cruz thing here. Just keep talking.
Hey.
Don't give Jackie an opportunity to speak. Look, I don't think Kathleen Sebelius should be fired. I think that this is a very difficult thing. I think we have to come back as Americans and try to figure out how to make the system work.
Jackie Bally, they completely dropped the ball on this.
Of course they did, and I'm not going to say I told you so, but I told you so. You know, it cost $634 million for this failed rollout, and for Sebelius to say, oh, I didn't know that it was going to be failed or we needed more time is absolutely ridiculous. This is the president's signature legislative program. If we can't trust them to have a functioning website for his signature program, we're actually going to trust them to run it. And the contractors who've already gone through, testified at the committee hearings, they said we warned the administration what was going to happen, and they said ignore it, let's move on anyway.
Do you buy the argument that we didn't know it wasn't going to work?
Of course not. We didn't know. They said that about NSA. IRS, Benghazi, every single thing that's been coming out of this administration, we didn't know, or he said, we're going to find out who's responsible and get to the bottom of it. Or they do something even better. They promote people who are responsible for all of the mistakes to another level or a higher rank. So no, this is typical of this administration. We told you that this program was not ready for a rollout. It's now happening. I think one of the best things that could happen for us conservatives is for it to continue, and then a lot of the voters need to remember what the president promised, because it's not happening.
And that's an excellent point, I think. That, you know, the president's been saying all along, once we get this thing working, you're going to see what a great law it is. And now they're going to push it back till the end of November before people can sign up. It's going to be just a matter of a few weeks before millions of people have a chance to sign up. Shouldn't the president now capitulate and say, I got to delay this?
Well, look, I think it's difficult, because if you try to delay it, it causes all sorts of problems in how you do actuarial tables, insurance-wise. The thing that Americans should look for in this conversation, as they see this go back and forth politically, is that there are actually people that are in glee for this not working. Now imagine if you're a cancer patient and you don't have health care. Imagine if your kid has leukemia and you don't have health care. And you're watching this group of Americans fighting to prevent you from getting care for your child. Imagine how you would feel. So when you see these congressional hearings, when you see people talk about Obamacare as if it's the worst thing in the world, put yourself in the shoes of someone who has a loved one and can't access the belt healthcare, because right here in Harris County, we have the most amount of uninsured, and we have the largest medical center right on the corner.
We're going to have to leave it right there, but I do want to point out, Donnelly, that you don't have to buy this insurance through the government's webpage. The law says you can go to any of the brokers or directly to the health insurance companies, and they have to provide the insurance based on the law. So you don't have to go through the government webpage.
Okay, yeah, and that's a good thing that you can get it somewhere else. And Chris, I want to point out that that was the fastest yes I've ever heard Jackie back. Chris Tritico said, should Kathleen? Yes.
she jumped in on Mustafa's time.
Oh my goodness. All right, now to some more important stuff. Did you guys taste that Tres Leches cake yet?
And not yet. We're headed in there right now.
Yeah, we're going to get some.
It's actually really good.
I got my coffee. Ready to go.
It's really good. And thanks so much, you guys.
Thank you.